All new at 6, big reforms may be in store for Hawaii's medical marijuana program, along with a crackdown on illicit CBD outlets. The changes would make it much easier to get medical cannabis and harder to find it illegally. Daryl Huff has details.
Lawmakers say they are giving up on legalizing recreational marijuana for the time being and shifting their focus to making the medical marijuana system better while cracking down on violators.
If I can't grow it here, I can't grow it at home.
These people have to go somewhere, and we don't want them going to organized crime in the black market for their medical conditions.
Hawaii's 25-year-old medical marijuana system has needed updating. Fewer people are using regulated dispensaries and may be turning to unlicensed CBD stores and illegal dealers. They were also concerned about community grow sites getting too big.
The loophole became a massive giant hole that was essentially undercutting the whole industry. And so that's why we need to regulate.
So senators have proposed a host of changes. One of the biggest would let a medical professional decide if cannabis would help a patient instead of having to follow a restrictive list of ailments.
These three conditions, anxiety, insomnia, and depression, are things that I think a certifying provider could reasonably consider for patients who are suffering from these.
More dispensary outlets would be authorized for rural areas, and for the first time, licensed cultivators could sell medical-grade cannabis to the dispensaries.
We need to have more cultivators who are producing high-quality flower for patients. So that could be a potential benefit, but that's a big change.
They'd essentially be able to wholesale to various retail locations, which is the way alcohol works. It's the way tobacco works. It's easier to regulate.
Bills in both houses would also restore the system of caregivers to help people who want homegrown product, although the health department opposed letting caregivers help more than one patient at a time.
We would ask that one-to-one relationship be maintained to reduce the risk of commercial operations and diversions.
The bills also crack down on CBD stores by requiring licenses, seizing products with THC, and then shutting them down.
So it's not only the ability to immediately seize and immediately and fine and forfeit, but to also be able to go after the establishments themselves.
The crackdown would also extend to anyone abusing the regulations, including patients and caregivers, which concerns advocates.
Patients already have to violate federal law to participate. So if you start adding on all these punitive measures, patients are going to think it's not worth the effort and they're going to go back underground.
The Senate's proposals must now go back to the House, and it's a lot to absorb late in the session. But House leaders say they do agree about the need to improve the dispensary system and crack down on the illicit markets. Daryl Huff, Hawaii News Now.